Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-Year Cancer Survivor. I want to take a moment and talk about something that affects not just those who were treated for Hodgkin's lymphoma, but many different cancers. If you were treated with radiation therapy, understand that radiation is going to do damage to the bones of what area you were treated by. For instance, in my case, I was treated what's considered upper mantle, which basically goes from my jaw down to my abdomen. So when it came time for my open heart surgery, which I've talked about previously, and the breastbone needed extra time for it to heal. What I want to focus on, because like I said, this is going to impact many different types of cancers, whether it's tongue cancer, throat cancer, perhaps thyroid, anywhere that you're going to be exposed to radiation therapy along the jawline. Okay, so again, the radiation is going to do damage to the jawbone. There's something called osteonecrosis. Now, I've got to watch so that TikTok doesn't smack me for using the wrong word. But if you break down osteonecrosis, osteo is bone, necrosis is not alive. Okay, so your bone is not alive. And what that means is that your jawbone is actually more fragile than what it was prior to those treatments. And this is something that can affect you in the short run or, as in my case, in the long run. I do have an uncle that was treated for tongue cancer over the last several years, and he's seen problems with his jaw and his teeth as a result of having had that radiation therapy. Myself, I also do have an issue with my jaw, though I have not had it broken yet. I try to avoid that, but I have lost several teeth. What happens is the enamel breaks, just dissolves, and it basically, my teeth just crumble. I end up with other issues that leave me no other choice but to have the tooth extracted. Okay, you have to be dealing with a dentist that is aware of your radiation history to your jaw, and they will be the ones that will tell you not a good idea to do certain things such as implants. Fortunately, the teeth that I've lost are in the back and you can't really see them, but if they were in the front, chances are they would want to do implants. And because of this osteonecrosis, you run risk of having damage to the jawbone itself. So what do we do for that? I deal with an oral surgeon who's very familiar with my health history. And under normal circumstances, when it comes to jaw work like that, you're likely going to have two suggestions. One would be hyperbaric treatments, which is oxygen treatments, any number of them. I'm not sure how many because I'm not able to undergo hyperbaric treatments. I have one little complication with my cancer history in that I was treated with a drug called bleomycin. So if you are a Hodgkin's survivor and you had the treatment regimen ABVD, there's a thing called bleotoxicity, which prevents you from undergoing hyperbaric treatments due to bleotoxicity. So there is something that oral surgeons can use in advance. And again, I'm not a doctor, I'm not a dentist, I'm not an oral surgeon. I'm sharing my experiences with you so that you can ask your dentist, your oral surgeon, about these options that are available to someone in the dental field who should have the knowledge of what to do. And this other process that I go through is called PRP, which stands for protein rich plasma. My understanding is that this PRP is not only used on the jaw, but can be used in other areas, other things with the body. Hair growth. It's about using your own body's plasma to help heal. So what happens is, as I go in, and I've done this 4 times now with the 4 extractions that I had to have, they take blood from you and they spin the blood until all that's left is the protein rich plasma. After they take the tooth out, they take that plasma and they put that into the hole of the jaw where the tooth came, and then they stitch the gum shut. And that protein rich plasma helps heal the jaw. I may be oversimplifying how it works, but I can tell you that it worked for me 4 times out of 4 times. So there you have information on dealing with jaw and dental side effects from radiation. Radiation, it's often necessary for treatments, but you need to be aware of the side effects, whether they be short term or long term, and the risks and what you need to do to protect yourself and heal better. Until next time, this is Paul's Heart.